So the first thing we should do here is define what a fever is, and that number sort of depends on the child's age. Now, for a child who's 3 months or younger, any temperature over 100.4 is considered a fever, and it's also very concerning if a child that age has one. So if you have a baby 3 months or under, temperature over 100.4, you should be calling your doctor right away. The idea that 98.6 is the normal temperature is actually more of an average, and a child's temperature will vary throughout the day, anywhere from 97 even up to 100 degrees. There's also a lot of fever phobia out there, and people assume that the temperature, for example, is going to cause brain damage, and I can assure you that that's not going to happen with the kind of temperatures that kids get when they're being sick. So instead of focusing on a number, I'd instead, take a look at how the child is doing overall. As a parent, you know better than anybody what's normal and what's not normal for your child. And really the focus here isn't to get the temperature down to a certain degree, but instead to make your child more comfortable. Getting the fever down may make your child feel a little bit better, may maybe help him sleep better, eat better, act more like himself, and it's really important with a fever that a child's able to especially keep in enough fluids that he doesn't get dehydrated. I recommend either ibuprofen or acetaminophen as the best way to manage fevers, following the directions that are on the bottle. Now, sometimes it may say on there, ask your physician. If that's the kind of information, just go ahead, call your doctor's office, and they can give you the information you need on this. Now, a really important part of giving these medications properly is measuring them out the right way. It may be tempting to reach into the kitchen cabinet and pull out the spoon you'd use to eat your cereal or soup with. Those spoons are typically very inaccurate. Instead, use the measuring device that's provided with the package, or get one from the pharmacy, just so that you know you're giving the child the right amount of medication. Now, if your child has other symptoms that concern you, like trouble breathing, a bad cough, a rash that looks like somebody took a marker and put little dots on them, basically, if you seem concerned at all, or if the child's under 3 months, again, call your physician for this right away.